Dr. Rayford from Vet Triage here. We are going through this October 2016 issue of JAVMA, and we're working through this article called What is Your Neurologic Diagnosis? This is a 3-year-old golden retriever, progressive vestibular ataxia and cervical pain of 2 weeks, moderate vestibular ataxia with leaning to the left side, mild left head tilt, and some resistance to ventral flexion of the neck. The only thing that the complete blood count and serum biochemistry profile found was mild hypercholesterolemia. Otherwise, the exam was pretty normal. When you think about vestibular disease, you think about 2 different categories. It's either peripheral or central. Central means in the brain, peripheral means outside the brain. And the biggest defining factor, amongst other, but the biggest defining factor is postural reactions, specifically testing hopping reflex. Hopping tests both the combination of conscious and unconscious proprioception. And if there's abnormalities in hopping, then that points to a central lesion. Like I said, there are other central signs, like for example, if there's nystagmus that's a vertical or constantly changing directions versus just standard horizontal. Horizontal could be peripheral or central disease, but vertical nystagmus or changing directions is usually indication of central disease. Anyway, MRI was performed, and you can see here they found a mass by the ventral portion of the cerebellum. There's also some edema here in the brainstem, and there's more edema here in the frontal lobe. MRI found a ring-enhancing cyst-like mass within the 4th ventricle with smaller masses within its wall. The mass was hyperintense on T2 weighted and flare images, so hyperintense here, meaning that's bright. And it was hypointense on T1 weighted images, so here, hypointense. Moderate edema within the adjacent medulla, that's right here, or medulla, depending on how you want to say it. Obstructive hydrocephalus with transepidermal edema, so right here is dilation of cerebrospinal fluid, it's hydrocephalus. And mild cervical syringohydromyelia, which I don't know if we can really see on these views. Patchy intramedullary edema. Differential diagnosis include choroid plexus cyst, choroid plexus tumor with cystic dissemination, epidermoid cyst, and respiratory epithelial or neuroenteric cyst. So the neck pain was probably due to the edema, the hydrocephalus, and maybe even meningeal stretching is what I'm thinking. They didn't comment on that here. Surgery is recommended with the goal to decompress the brainstem, alleviate the obstructive hydrocephalus, and collect tissue samples. A foramen magnum decompression was performed, so they went here around the foramen magnum, where the brainstem turns into cervical spinal cord, and they can access the brain tumor by lifting up the cerebellum and removing it. They removed a green-yellow mass in 2 large pieces. It was well encapsulated, contained thick yellow material. An atypical epidermoid cyst was diagnosed, given that the epithelial lining was not keratinized and the lumen of the cyst was not filled with keratin, as is typical with epidermoid cysts. The fibrous connective tissue wall of the cyst had multiple cholesterol granulomas and occasional hemorrhage. The dog was normal 73 days after surgery. 1 year after surgery was normal. Intracranial epidermoid cysts are rare, congenital, slow-growing masses that develop as a result of defective separation of the neuroectoderm during formation of the neural tube. So that explains, this dog was only 3 years old, so it explains there was a congenital condition. In humans, atypical epidermoid cysts comprise 5.6% of all epidermoid cysts and may differ from typical epidermoid cysts with regard to diagnostic imaging characteristics, gross findings, and histopath. Atypical epidermoid cysts account for a small percentage of total epidermoid cysts in people. Atypical epidermoid cysts are generally larger than classic epidermoid cysts, and often are associated with pre- and post-operative hemorrhage. Histologically, they often contain granulation tissue and cholesterol crystals. Both can be related to the hemorrhage. The granulation tissue is highly vascular, which predisposes to bleeding. Cholesterol crystals may then develop secondary to hemorrhage. The presence of hemorrhage, cholesterol crystals, and granulation tissue may account for the atypical growth and MRI findings in atypical epidermoid cysts. Epidermoid cysts have an associated capsule or capsule, and complete excision of this capsule appears to be necessary to prevent regrowth. The capsule adheres to surrounding neurovascular structures. Epidermoid cysts are not responsive to chemotherapy or radiation. Therefore, aggressive surgical removal is important. So yeah, this is a cool study. It's straightforward, and it's an uncommon to rare disease in animals. I showed this image from online from another patient, another dog that has got a brain tumor. I just want to show you what an obvious brain tumor looks like in dogs. So when clients ask, and I have a video about this somewhere on my channel from years ago, if you want to check it out, brain tumors. When clients ask about brain tumors, is it cancer or not? The real important question is, it may not matter, because just by definition, if you have a benign tumor in the brain, because it's located in the brain, by definition, I consider it malignant. Now, it's not malignant from the standpoint of it might spread or grow or cause hemorrhage or whatever. It's malignant from the fact that it's in a bad location. So even a benign brain tumor in a bad location can cause severe clinical signs, even though it's benign, because of its location. So, all right. Thanks everybody for watching. We'll see you again tomorrow. Bye-bye.